present Pavel Ivanov, who's going to present this beautiful machine that I use 5 years, and just there is something new, the microscope, and we see it's amazing technology. And you're all welcome, and I know all of you, right? Except this girl.
This is Mr. Novak and Elias.
Please, yeah.
Elias, sorry, my pronounce is not perfect.
No, it is.
And they are users of our equipment about a few years already. So I was going to start from our well-known equipment that is intended for bioresonance diagnostic, but I will start another software just to check how it works, and we will. So I was asked to make some show by Raif, but I am not. I don't know how to make show. The best show will be when you will see possibilities of our software, and when you will find out the price, because we have very high possibilities with very reasonable price. So we have traditional bioresonance equipment, NLS diagnostic machine for common health testing, for screening test, and possibilities of this machine allow to user check all the bodies by separate organs, and and to find out diseases in this organ, and to find special individual treatment for the person. So how is it works, we will show you right now. By the way, I need someone who want to be patient.
I want to. I want to.
Unfortunately, I did not see who was the first.
She was first.
Sorry. Huh?
She was first.
Okay, so
Okay.
come here. Sit down here. I will need
Over
this
there.
place. Yes, please. And of course, it's very important to know that this machine will not do job of a doctor. This machine will just help to make this job as better as possible. So this is our newest device. We call it Dianel-22S Ion, and main features is that this machine can make resonance NLS diagnostic, and the second software, second option is psychophysiological testing. We start from resonance diagnostic, and psychophysiological test we will put to the end of our presentation. So I have English interface special for you, and we start English software, we call it. I think that this is maybe not enough. I know that other companies they like to tell they are 2 years on the market, 3 years on the market. So, but we working for our customers. By the way, I want to say that since this year, we decided to make all updates of software free for our customers. We have now links on our website, and it's possible to download new software Old users sometimes need to change USB key, but it's unfortunately we cannot make influence on it because of changes of operating systems, etc., etc. Okay, our software. So our software have different possibilities of card index, of list of patients and list of operators. Here can be a lot of operators. It's for maybe big centers. I don't know. Is there someone who present a big medical center or alternative center? Anyway, it can be a few operators. And every operator have his own list of patients. New software have possibility to move patients between operators and even between PC. For this we have administration option that is closed by special code, and this code is so this code we have on card. This card goes in complete set and contains serial number of device and special code for this serial number of device. So let's start with patients. Name.
L-E-I-S.
L-E-I-S.
L. No, it starts with L.
Yes, it starts from L.
A.
Work.
That's good enough.
And
You're gonna charge me?
no. By the way, before we enter this picture, before we enter this window, we advise to doctor to talk with patient and to ask the problems, the complaints, and disease, because it's very important for doctor and for our equipment to put correct analysis. So, what problem do you have?
I would say I have back pain.
Back pain.
Yeah.
What else? And how is it often?
All the time.
All the time? Morning, all day long?
Usually all day long. Yeah.
So,
Middle back, same thing.
and what else?
Tiredness.
Mhm.
A bit of stress.
Mm.
Not too much.
Mhm. What do you mean stress?
Stress, like
Do you feel nervous?
where am I going? Like when you have too many things to do, then you kind of get more nervous, agitated, you know, anxiety.
Have a look, please. We can move point to move it to correct area of pain if we have, and what kind of problem?
No, painful, it's like a frequent, yeah.
Uh-huh.
Whoops.
Okay.
Did I pull it
Child
out?
birth, abort.
Sorry.
Next.
I think,
That's okay.
yeah.
About diagnosis, some Fixed diagnosis by previous diagnostic, medical diagnostic.
Actually, I don't go to doctors.
I'm not surprised.
For
Okay.
8 years now.
She used to go and she was way sicker.
Yeah.
So at this moment we are ready to start testing, but by the way, we advise not to forget about such options like as ask specially for some resections of some bodies, maybe resection of, we can find it easily by R, and resection of
What is a resection?
resection. It means to cut something. Resection of left kidney. I hope, of course, not.
Oh,
Like
okay.
You mean second?
Yes. So missing
organ.
organ, but by surgery.
Okay.
Yeah.
Uh, Как называется удаленный?
Remove
Аппендицит.
gold,
Аппендицит.
remove.
Appendectomy.
Appendectomy. So we have special appendectomy.
I want to say something
Yes.
about my eye that I lost.
Just missed it.
Before.
Two up. Yeah, you
Oh,
pass.
yeah.
Pass. Down.
Yes.
Yeah.
Here it is. So if patient has it, so we should. It's better to check it here. And you told about eyes.
Yeah, I took a medication a long time ago and side effect, I lost vision. I didn't recover 100%.
So we
My
have
left
some
As the optical nerve action.
impaired vision of eyes.
Yeah.
Yes,
Yeah.
and right.
No,
Only
just
one.
left.
Just left. Okay. It's okay. Until we, so we have two options of test. It can be a fully automatic test when button after pressed. We can press start and software start testing all the organs and add to this list that we see now additional organs more detailed and more detailed. In this case, diagnostic can be quite long because of we have about 276 organs. But even in this situation, because it's on machine opinion, we can not, it can be not tested some organs important. And we advise to use manual test. So we unpress.
How long if it go automatic? How long if it's full?
It depends on quantity of organs. If we make it in manual mode, we can choose about 15 organs. It will take, not 15, 50 organs. That will be enough for, mainly for the most of patients. And it will take about 15 minutes.
15, 1-5?
Yes.
15.
And if it's a go for all, it will take like 1 hour or?
It depends if the machine finds something, then go more deep in microscopic view. So sometimes can take hour and even hour, more than hour. Depends if you put the auto, we'll go through all the organs.
Yes, if we use automatic mode, but if you use manual mode,
Yes.
we put, firstly we select that organs that we want to test by checkpoint, and so list is fixed. But after end of test, we can add something more if we need, if we want to do it. So 15 organs, 50 organs is about 15 minutes, but the whole test of and 70 organs, yes, about maybe 1 hour, even more. Now we will make not very long test. We advise to test every time basic organs, basic catalog BC, and most organs of the whole body. So posterior wall of stomach, pancreatic-duodenal zone, small intestine, large intestine, liver. Gallbladder is included in liver, but we can make it special. Breathing system. For easy checking, we can press preview button, especially window appears, and we can see what does it mean. For me, I'm not a frequent user of English software, so I prefer to check it with picture. So kidneys in rotation, and we can test kidneys without rotation just for demonstration. For women, so it's cells. For you, spinal nerves and section of spinal cord. If we have no problems with joint, we can test it, but only we have special surface. Okay, that's enough. Take, please, chromosome. This is to the left, this is to the... by the way, you take off all your metal rings, and for women and for everybody, we advise to take off neck rings, neck chains, so earrings, and rings from arms. Very important to take off earrings because they are inside of working of magnetic inductors, and they change magnetic field a little, so we advise to take it off. And sitting comfortable, not cross legs, not cross arms. Yes, yes. So we move emitter to the head of our patient and press start. Once again. So when we decide to work with the manual mode, we need to make it right together, unpress after and press correct. I forgot it, and because of it, list of organs was refreshed when I was press correct for special option of our software, and we need to put this once again. Okay, that's okay. And now we start testing. So we see two graphics here, and this is a graphic from magnetic conductors, and this is graphic from electrodes. At this window we see special functional markers that shows us the functional state of organ. Every organ will be with these markers, and it's possible to print it out with these markers. So these markers shows energetic balance or pathologic condition of organ. Later, together with testing some preparations, we will see how can be changed this functional state of organ together with the influence of some remedy. Here is described the description of these functional markers. During this test, we have some time. Maybe you have questions. I will answer you.
Yeah. What does mean 2-3? It's all the time come out like 2-3, 2-3.
It's like a normal.
Normal?
Yes. So we can describe
What's the
initial
difference?
3 is initial infringements of homeostasis, but usually it's normal for patient. 2 and 3 is okay. Yes, 2 is a condition of functional balance. And 3 is a little worse, 4 worse, etc., etc.
But what is 4? Because it's come out on 4.
It's worse than 3.
It's come the state of the organ evaluate in 6 stages. So 1, 2, 3, it's a normal stage of the organ. 4, there are some changes already in the homeostasis of the organ. 5, which is blue, express changes, and the black one, it's more chronic, more deep changes. So that's the way evaluation of each organ.
So 4 represents functional pathology
No,
and it moves
yes.
towards
4, moderate. But
Moderate effrigements of
Yes.
homeostasis. So it's maybe 2 scientists there is special description of these points, but for patient it's better to describe that 2 is okay, 6 is bad. If you have 6, so you have some pathology or serious disbalance and it's necessary for treatment. But there are sometimes such situations that some patients have a lot of 6 marks, maybe on one body or maybe all over the body. And but really after the analysis of these organs, we see no real pathology. It means that he have some energetic disbalance, but not pathology yet. And it's very good that he came at this moment, and it's necessary to find some treatment for him and to correct this condition before some pathology appeared.
So 6 doesn't necessarily correlate with diagnostic tests done by conventional medicine.
So main test is making special analysis of organ, where we can see, you will see it later, we see a list of diseases with special coefficient, and we work with this coefficient. This marks is just to make motivation for person to make him not believe, but to make him see and think that he needs some help and that patient needs some treatment.
Okay, so I still don't understand. If they show a 6, let's say, is a 6 going to correlate with the diagnostic test?
Yes, it will correlate in most of situations. But usually, yes, usually, but sometimes it's seldom. We can see that there are some few possible diagnoses, but they are on board. It can be a little more. It will be active, this pathological disease. So we can see it before he becomes real. So we can see it on the early stage.
Yes, but is 6 considered the early stage,
6 or maybe 5 at this moment. But when we have a lot of 6 on the organ, usually we see real pathology, and we know this pathology by analysis, and so we can advise some treatment, some remedies for person. So of course it correlated, but sometimes it can be just energetical disbalance, but without real pathology yet.
on a 6?
Yes, even we see 6. Sometimes it's like maybe deep stress of person. So I'm from Moscow. There are a lot of customers come to us to Moscow after a long trip. Not frequent, but sometimes we see a lot of 6, but no problem really. It's just a stress after some road. And we advise that patient should come to you with his normal condition, without some special preparedness, without some special treatment before this test. It's very important to test patient during test, doctor should talk with patient, and patient of course can answer, and they can watch the picture of organs and talk about health, about some problems. Maybe during this talk, it's possible, not sometimes, so if this disease, if this pathology frequent, so we measure it more accuracy. It's about 90 and even more %. For example, some stomach illness. But if it's not very often, some heart diseases, maybe some tumors or cancer, it's a low accuracy, it's about 85%. But all this percent is correct when specially trained doctor work on our system. And doctor with good experience with working with the system and even in naturopathy. So we advise to use this machine as with every patient for first test, for meeting with patient and to find out what is the problem and advise the treatment, and then maybe advise some other way of maybe diagnostic. It depends on problems that we find out. So we cannot say that this is medical, because in this country it's not medical. And if we find something serious, we advise to recheck it by some other way. Ultrasound, X-ray, or any other way of diagnostic, especially for this disease that you find out. If it's possible, if not, so it depends on situation, on patient, of his problems.
In Russia, is it accepted as a medical device, or in
Yes.
Europe?
Yes. In Europe, not yet. In Europe, we have certificate of compliance to European standards, but like technical device, unfortunately. We work now on preparation documents for CE mark, and then we will start FDA certification for Canada and other America.
And then you think you will have this FDA?
I wish to promise you, but
The big boys get kicked out.
so we will do it. I hope it will take not more than 1 year. Even for every delays, I hope. Maybe a little more. It's bad, I know, but so it's true.
I just want to clarify. So even at 6, it still means it's functional pathology and it's fully reversible, or did I?
It depends on pathology.
No, when you do analysis, you can check if there is deep pathology, because in analysis you will see diagnosis and differential diagnosis. So, and I have a couple of patients with lots of black dots, and then there is another thing that we can do if it's improved fast or not. And I send them to medical test. I find some lung cancer that wasn't diagnosed, and when I see that was really very deep, all these black dots, they did not come out, and was really in analysis show something more deep pathology, and was lung cancer, and I have another patient with breast cancer. So it depends, it's not only the dots. There is some more things you can do.
Okay, so you can see functional pathology and you can see organic pathology.
It's all Yes, we
Okay.
can say this. It depends from the pathology that will come in analysis and the differential diagnosis that we can make.
By the way, I want to say, so as a result, we have list of tested organs. For our comfort, this list is marked by different colors. So green one it means that we have all marks till 4, including 4. If we have red colored organ, it means that we have minimum 1 mark 5. If we have brown colored name of organ, it means that we have 6 marks in this organ. So we advise to start, of course, from the whole body. It's a previous analysis of the whole body, and here we can see the previous result that we will check together with other checking other special organs. So here is database of our software. Here I have all database, so 93 group. But usually for customer, it's necessary to use something about 20, maybe 30 groups. We have standard group till this. So if you have more short database, it will work faster. And the second option, so you can choose only the groups that you need. For this, we have special function of license request, and we give only that groups that customer prefer. So we start from finding some problems, and we select pathomorphology and nosological forms, and we see list of some diagnoses with special spectral similarity coefficient. For example, we have pyelonephritis. Okay, we will check it with kidneys. And chronic pyelonephritis, excess of biological age. This process we can check only in male or female body. In this situation, we see that excess of biological age, it's like a stress condition. And if it's present, we can advise some rest for patient. And we will put it to future epicrisis. So, high possibility coefficients are marked with red color. All other is other colors. So, all that organs, all that etalons that are less than 4 to 5 will be red color. It means that possibility of this is 60 and more %. So we go to other organ, so urinary system. Every organ contains only that etalons from different groups that are suitable for this organ. For example, we cannot test male problems on female organs, and contrary. And for example, for urinary system, we cannot test some illnesses of breathing system. We will not see it because it's impossible and not correct. Okay, pyelonephritis. Correction shows us low coefficient. We can a little lower, and we can use entropy analysis for special analysis of this problem. So we have this function shows us step by step developing from healthy organ to organ with this problem. You can see that healthy organ have very close graphs. What does it mean? So there is no disbalance between we measure magnetic fields, and magnetic fields can so it's north and south magnetic field, and we measure together, and only together it shows a condition of the body. And if organ is healthy, there is no disbalance, and north and south waves will be close to each other. If there are disbalance, so it moves to some other condition with special disbalance. For example, on this frequency, on this frequency, and this frequency is the biggest disbalance. So software calculates this and shows us coefficient of spectral similarity. We see 0.24, and it higher than here, and we can say that this process is in remission. We can add it to the picritis and make make some explanation. So chronic pyelonephritis, urethritis, cystospilitis. We see similar diseases that can be present, and so you, like a doctor, should select from this only one or maybe two correct, because you know that everything starts from the one and goes bad, more bad and more bad, and they are similar, and one can be after another. So we should select in every condition only that with low coefficient and more correct possibility.
I have a question.
Yes.
I took antibiotics and antidepressants for 13 years every day. So I wonder if you can check with the machine if there is a heavy metal toxicity or anything like that in the bladder or kidneys.
We can test some remedies. Not some, we can test any remedy using bioresonance chamber, and we can compare the influence of different remedies, and we can advise the best remedy for patient. If you have examples, no problem, we can do it.
Okay.
For test, it's necessary to use a glass bottle. So it's an organ from urinary system, and we see the compatible situation with previous organ. So if it's some special cut for some problems, we can check it here. So, and we make step-by-step testing. step-by-step analysis of all the organs. For example, your stomach is quite well, looks well, and there is no problems, I see. Even this bacteriosis looks very good.
After 13 years on antibiotics?
But, so,
It's
this
a-
is not
it's
simple
a-
patient. This patient, this is doctor. I think that you took some
Herbs.
herbs.
After I did a lot of cleanses and I took herbs and homeopathy.
So how do you feel about your stomach, for example?
Sometimes I feel like pain here. I don't know, maybe it's anxiety, you know. Maybe it's just anxiety.
So left part. Okay, we have, let's check this. So, this system looks well.
Does it give us some kind of summary what they should be concentrating on?
Sorry, did not catch
Does
you.
the machine give a summary of what it's found? What would be where you have to concentrate on?
Yes, summary как заключение, как...
Yes, so we are preparing the summary. I told that we, all that I just not finished, and I will show it a little later. So, we check the main organs and that organs that have pathological marks. Entropy analysis, and there is no problem. Even we have 5 here, but even 6, but there is no real pathology, as I told you before. Some disbalance, so we can check it other way. Maybe we should check biochemical homeostasis. So this is special group that shows us the condition of blood and urine. Some, for example, leukocytes more than 4,200 in 1 milliliter of urine. We can add it to epicrizis. Sodium in urine looks that quite. So it's maybe it's this parameter is near to the high level, or maybe above the high level that allowed for patient. So, NLS analysis helps us to check condition of blood, some parameters in blood and in urine, and we have we can see this parameter, and it looks that it can be high, and we can check potassium in urine, for example. It looks like normal. And ammonia in urine, for example, it looks even good, maybe less than normal, but coefficient is 0.7, so we can say that this is to be coefficient, and in this situation it should be normal. Okay, exit. And and lymphatic vessels. No pathology, but biochemical homeostasis looks not well. And there are a lot of high possibility parameters. For example, blood serum creatine more than 71 mole per liter. We can make sorting by name, and it will help us to find the main parameter for NLS analysis. For when it's written here that NLS, it's not no accordance, but the main is this one, and it's have accordance, and we see that blood serum creatine is possible that higher than normal. And we added to epicrisis. So, and checking all different groups, it's possible to find out the to help find the real reason of problem. Microorganisms. So about microorganisms, it looks okay, and this is lymphatic vessels. We have quite new groups that we call contaminants, dietary supplements, like chemical additions to food, and energy informational overburden. So this can make bad influence for patient, and we can advise to checking these parameters, we can advise to prevent this influence, to, if it's possible, geopathogenic burden, maybe some place is not well enough. Radioactive stress in radioisotope. Or this is can maybe this will be not good for patient, but he not have this regular influence of this stress. So for everybody will be worse if frequently X-ray radiation.
Does it show history? Let's see. I had the X-rays done in this period a few years ago. A few of them.
Few years ago, it's not a problem, but it's not you for you. It's better to not to do frequent.
Mm-hmm.
So choose other way of diagnostic if it's possible. It depends on situation, of course, but we can advise you to not to test it frequently, because it can be for you it can be bad. A vibral load, it's some vibration, maybe somewhere. Okay. The other leg is bad. But we check first. We check pathomorphology and nosological forms. It looks well. So, and we can check magnesium. The picture is the same as left leg and right leg. Okay, spinal nerves. You have complaints for this? Start from pathology, medical function. Intercostal neuralgia, correction. No changes, almost there. So, and about entropy analysis, it looks stage 6, but coefficient is quite big. So, I'm not sure about it. Maybe some other process. This one. This one. Herniation of intervertebral disc. 0.34, and here is, so it's equal coefficient, and this is most possible process. Okay. Other. So maybe we make corrections for that parameters that we think that we should choose, and to understand what is the most important and the most possible. And it looks that herniation is most possible than others. Coefficient is big. It's red marked, but it's just not to lose it where it is. So it stage 6, because of it, this coefficient red mark, but it not depends on the value. It's just not to forget that we are working with the 6th level. Okay, a little I start training. So step by step we check, and you can move it to epicrisis too, because it have quite low coefficient and quite possible. Brain and arteries. For mine, for fatigue, looks well. Arachnoid membrane. So, quite well. Vegetative system. We have such picture before. So this parameter is quite possible to wear, and so on. About air ground left. Myopia. I see no special problems right now. Even stage 6, but coefficient is quite big, so we cannot say that this person has myopia. Maybe in some remission. Coefficient is quite big here. You see, it was changed, so program calculate all the coefficients, and now we see it correct coefficient to this body. So left side view looks worse. Spondylosis. So on this cut, we see other coefficients, and so not at this area. Okay, we fixed this picture already. We added to epicrisis, and that's enough for us. About chromosome, we can test it, we can print it out, but we advise to work with it in special, only in special situations. If it's necessary for patient, because we work with person who already born, it doesn't matter. We need to decide his problems, and so it's some genetic, and it's usually serious and better not to deal with it.
So each chromosome shows some specific genetic problem, right?
Mhm.
Each of the chromosomes.
Mhm. It looks well. 5 is not a problem. Only 1, 5. Okay, this is just analysis, but our software have very interesting functions, and I will show you how it works. So from this window, from card index, we select some urinary system for some organ, and here we can find I don't know, what is the well-known dietary supplements. Okay, let it be some homeopathy, heal, for example. So in this list we see we compare diagram of influence of some remedy. In this case it's homeopathy remedies, and how it will make influence on this organ. So we compare diagram of influence of remedy with the diagram of condition of body, and the most useful remedies is in the top of the list with less coefficient. So we can make special vegetative resonance test. Yes. So it's for urinary system. We select testis compostium, sexual weakness, including stamina. Okay, let's test. We can test few for patients. So we found some problems in this area, and we can find out some special treatment. And even now we see that it becomes better, because all urinary bladder was 6 marked, but now it looks well. Okay, maybe some other remedy will be better. Let's test it. No, it's a little worse. Maybe on the other field it may better influence, but okay, and memordica composting. Unfortunately, no description, but who knows, that knows.
On the left chart, what is the blue and the white and the red represents on the chart?
Sorry, what you ask? Blue, red, what?
There are lines.
Lines.
It shows
Okay, once again about lines.
over there on the left side.
This one.
Yes.
Okay, so I switch off all the lines. We have now we have lines. We select some etalons, but these lines does not change. This is lines that is for our organ, condition of organ. So we cannot work only with one blue line or with the red one because it's combination. It's a magnetic field, magnetic fields, and they can be only with plus and minus. So blue one is north, so it's minus charged, and this is red, south plus charged. And we compare it with okay. So these lines shows only condition of the body, and we compare this condition with our etalons, and according to this comparing, we can find the best remedies, for example, and the most possible disease. So we made 3 vegeta resonance tests. We can make it for every body that have pathology, and to find, so I will put it everything to future decreases, just to show how it works. And now we will make, for example, for other organ, we will make vegeta resonance test. If we have some special remedies that are not present in this database, we can test it through vegeta resonance chamber using this function. But we have no remedies now, no test.
How it works? It's just dissolve in the water and you put the...
We can test pills, we can test liquid, and so
powder.
powder, yes, and even maybe oils or most of things, but not plastic, not metal, because it will not work.
And this is like already on the program, just names of remedy, like
Sorry, didn't catch you.
it's like you got ready names of some homeopathic.
Yes, we have it already in database. Maybe someone of you works with Veleda, someone works with Guna or Roy Martin, I don't know. We can test, you can test it from our database.
I have a question. When you clicked on heal, does it have all heal remedies?
Not all, because Hill is the big company. Only that Hill remedies that we tested till this moment. If you have, if you will see that we have no some special, very important Hill, we can find it in Moscow and test it. If we will not find it in Moscow, we will ask you to send us examples and we will
Oh, I
test
see.
it. So
So you
if
don't
you
have
work
the
with,
whole line, just selective remedies.
yes, If you work with some special dietary supplements or
Do you have
homeopathic,
single homeopathic remedies here, and in what potencies?
There are lots of single remedies. On homeopathy, there are lots of more single.
okay, belladonna, for example, description, and we can make Vegeta resonance test once again for this all. So, Vegeta resonance test shows us the future condition after the course of taking this remedy, or dietary supplements, or some other.
Can you treat with this also?
Treatment we have like other functions. So,
So you have only low potency, D3, D12. How high do you have it entered? Like, do you have 30 CH 200 1M?
I'm
No?
not specialist in potencies of homeopathy, so it's a so as it's written, so D10, D4, D12.
But if you have the vial, then
You
you
can
put on
test
the
it.
chamber and you test. You don't need to take from there.
I'm not specialist in homeopathy potency.
But it's possible to enter, like if somebody wants specific potency, it's possible to add to the list.
Yes, yes, of course, but if you have it, you can use, I know that there are a lot of our users have special complete set of examples with some little sticker, and they tested with patient, especially for him. Even they don't, maybe they don't have it in database, or they make it more visual for patient. They take this bottle, make testing through this option, and they show the result, and it's more impressive for patient. And patient takes these remedies with better wish than other way. So about treatment, our system have energy information influence function, or other system, analyze system call this function moral therapy. So it's the same, and here it works this way. We select some zone of influence. We can move like this center, and we press evaluation button. Patient sits in sensors, poles, and energy information correction starts. Because we know we have inserted organic organopreparations in database, and it means that we know the correct condition of the body, and we make influence correcting, pushing the diagram the correct way. So we can make few influences for every body, and for 10 or 12 or 20 bodies during one day.
Can a patient get an aggravation after that?
What?
Aggravation, like initial worsening the condition before they get better after this treatment.
Sometimes maybe yes, if it depends on maybe some infection, but anyway, we advise to use this treatment function together with all the possible ways to make a treatment, because it's like if we have, so it depends on the problem. If we have some infection, it's better to make influence against some microorganism, it means bacteria. Then, because if we make this influence, it means that we charge organ for better work, but yes, it helps to fight against infection, but if it's some serious situation, it's better to advise some pills, some antibiotics, or something you decide what to advise. So it depends on the condition of patient, on his problems. you see that these marks not goes away a little, but so we will make it once again.
We can do it 3 times in one.
We can make 3, 4, 5 times, but maybe not more, because we can do it only. For example, now I see no difference between previous. So I think for today it's okay to finish on this step for this organ. We can go to other organ and to make influence here.
We can do for more than one organ at one time.
Yes. So it's okay to make for 5 or 10 or maybe 15 organs. It depends on your time, on time of patient, and on his problems. And but we advise to use this function not only one day. We advise it to use 10 days every day. Maybe with pause for weekend. It depends on your working on your working graph. Okay, we are going to the end of presentation of this software, of this equipment, and then we start other equipment. But very interesting and very impressive option we have, like comparative analysis. For example, we make tests of urinary system, and we need to check what is the best remedy or what is the best level of influence, for example. And using comparative analysis, we select organ and we press out a search. Cursor switches to heel compositum. Yes, testis compositum of heel. And it's very effective. Reduce of pathological zones 100% and improvement of functional condition 62%. So for this patient, this remedy is better than others, I think. So let's check it. Clear marked heel. Not so effective, but it's okay too, but not so effective. The third one, Memordica compositum. Even better than the previous, 62%, and Memordica compositum will make 72%. And I remember that the best coefficient was on heel, but Memordica compositum, it was the 2 or 3 from the top, and even it makes a better result. So, and for the same organ, the first energy informational influence or more therapy first step make 20% reduce of pathological zone and 40% functional condition improvement. And the second 22%, the third pathological zones better, functional condition better. The 1, 2, 3, 4. The fourth 35. So that's, we stopped after this. It's possible and it's necessary to show this option to patient and to motivate him to take this treatment or to take these pills. So the same we made with the other organ. It was organ of small pills. First information influence was 33%, the second was 47. So, and we can continue, I think. And about the result you ask. We have epicrisis. In this epicrisis we can put diseases with one button. We already have a list. During analysis I put it I added in epicrisis. So we have common process. We make sort of process like common process and special process for processes for urogenital system and for vegetative system, for nervous system. So it depends on the process. So it will be sorted by system. Results of automatic evaluation of spectral similarity. It's our quite new function. I will show you how it works. And about health improvement. In this list we have only few. I added on my opinion. I see that it works better than other, and I added as a result of vegetative test or as a result of correction. So here will be that remedies that you advise for patient for full treatment. And we can write here explanation how to take these pills. If it's necessary, so for example, 3 pills per day, etc. Okay, about automatic. So I checked tungs in I checked we press express estimate for automatic etalon selection, and system checks all the body and can add to the list etalons from special group. For example, homeopathy. Belladonna will be okay, dulcamara, so, and we can add it to epicrisis and open it in one click, and we can correct this list. For example, we can delete this, we can delete this one and this one, because you know that this is not quite acceptable on your opinion, for example. But all other you can leave. So, and as a result, we can move all these homeopathy etalons to the result advices. And we will delete it from here. That's okay. And during preview, we see how it will be. By the way, we have special field of recommendations to additional inspection. If it's necessary, we can advise to patient some analysis from templates, for example, osteoporosis, or some men for women, hormones. So we select something that is necessary for patient, and then we go to other. We can advise some examination if we need, and we can advise some consultations. For example, and that's okay. Here is the list of advices. because of course we need to help the patient as better as possible, and we can advise the health improvement program. It can be autogenic training. So we select it and we will add this advice with all the description. We can advise some massage. Maybe you use some additional treatment in your center, and you can advise these options for your patient, and you should advise these options to your patient. So it's like patient can take all the procedures in your center. We can advise on nutritional care. It's a Soviet separating depends on the illness that we have, that patient have. But diet for Crohn's disease and colitis, for example. Why not? And here is described what to eat and what not to eat. We can advise physiotherapy, some physiotherapy. We can advise gymnastics, and weight correction. This can be added by user, and so you can make your own templates for better and fast advices to patient. And as preview, we see it here. By the way, it's possible, so of course it's possible to print out, and we can print out pathological organs with some pathological condition to patient. He can go home, he can think about it, and he can decide to pass through that treatment that you advise him, if he did not decide it from the beginning. When you print your epicrisis for this patient, this epicrisis will contain your logo, can contain your logo if you will add it to, so for example, I have photo, logo types, and your logo. So currency, and so name of your company, clinic, and your address, website, email, etc., 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 etc. Okay. And when we will enter epicrisis once again, we will see all this information. So this is first is the name of clinic, and this is address and the logo, and it will be printed out. So it's for respectable companies. That's okay. I think that this is the end of presentation for this software, because most of you know this software, maybe some don't know. Anyway.